in my hospital, the doctor older than 60 years old was prohibited to go to the front line.
Really?
Yeah, sure.
This is we all our on the front line. All our junior physicians, they're working in that center. I actually also applied several times to go there. It was not approved by the authority, and we send our younger fellows go there, and we through the remote consultation try to get our opinion for the therapeutics. But secondly, and you know, we have in the by the 5th of February, I think, we send different groups of medical personnel from all over China, from different provinces, different cities. We have 42,000 medical personnel, of which 28,000 nurses went to Wuhan, and they take charge of different centers. This is also explains why in different groups the strategic plan is not maybe the same. The group take, for example, the blood test once a week. The other group said, okay, we do it's 3 days every 3 days. Maybe I think at the beginning, but afterwards, since the medical commission gave the guidelines, and especially after give the guidelines of 6 and 7. And all the teams, they follow the same guideline for treatment and the diagnosis. But even though different teams, maybe they have a different strategy.
Sure.
That's very useful and helpful. I want to just, the American doctors are going to be very interested in that response about the prohibition, though, on age, because we haven't done that yet. I wonder, Zhou-Ning, at your place, was it the same? Doctors older than 60 were prohibited from coming to the front lines. Was that true?
Almost the same, you know. If the doctor is over 60, it's better not to enter the ward, especially the ICU ward. You know, the ICU ward, the virus is too much for them. So we're younger, we are stronger, maybe. I think so. So we are resistant to the virus.
Yeah, in this case, it seems that's true. But let me ask you one other question about age, which is one question people have is whether one of the reasons the mortality is higher is because of the triage. When the system was overwhelmed with so many people, there was a preference, for example, for ECMO you talked about. I mean, ICU care was more devoted towards younger than older. In Italy, we hear this quite a lot right now, that they're triaging. Do you think some of the elevated mortality was because of the need to triage and to say older patients were not going to be prioritized, or that's not the reason at all?
No, in China it's not allowed.
I don't think so.
Okay. Because in Italy, they were saying they have so much demand for services, they're making some of these, or thinking about making some of these decisions. So that's helpful to know that wasn't what was going on at all. That's great. One other question that's come up for us is whether there are differences between men and women in the way that the virus is acting. Can you comment on the sex differences in, or at least your impression of any of these differences from your experience?
So, according to my experience, I think that the the men, man is more likely to be infected by the virus than women, and I don't know the reason. Yeah, but it's according to the data I collected, that data shows that maybe there's gender difference between the male and the female. Yeah.
And in my ward, most of the cases are male. Few of them are female. I don't know why, but I have 30 beds in my ward, I think more than 20 are male, not female. So that's where we have.
Situation, Hong Zheyong, in your center.
In my
what
word, maybe the male patient maybe more than half, maybe 60%. 60% patients are male.
We have collected some data.
Yeah,
and,
almost. Yeah. Almost.
Yeah.
We reviewed about 244 patients in our team. They include moderate, severe, and critical. I think about half of the patients are male and half of them are female. So
Half?
Not
It means
half.
equally.
Not half. Just 58 to 59% patients are male.
yes, but I think
Does it appear to, if you're saying it's more frequent in men, are you also seeing differences in the manifestations, in the complications of between men and women? Can you comment on that?
Mm-hmm.
临床表现
I know I don't think that so there are many difference between the male and the female, and no difference, but just the general difference, but not symptom and maybe the clinical condition, no difference, but at least in my opinion, yeah. Professor Joe, do you have some experience?
Because I worked in the ICU ward, so all of my patients are very critically ill. So in my opinion, the proportion of male in the critically ill patient, the COVID-19 patient, are male. I mean, I just said that I have 30 beds, 20 of them are male, and I have finished 5 ECMO cases, 4 of them are male. Just one female.
这里Helen ask but the clinical manifestation 他们临床表现有什么不一
Manifestation,
样
okay. Manifestation are very similar. I mean, for mild patient, similar. For the critically ill patient, I mean, not so different between the genders.
That's great. That's very helpful.
Yeah.
Let me ask another question, which is you're using an antiviral, Arbidol, which is not FDA approved in US, but is in Russia and in China. But we're also using our own antivirals. There's not much information yet for us about usefulness. There was a trial in New England Journal of some antivirals that didn't show benefit yesterday. What are you? After you finished this whole experience, what's your message to us about your experience with antivirals? Did they seem to make any difference? Were you able to study them in a way that you could determine their effectiveness, or just you don't know at this point either?
So what I think is that the antivirus, treatment should not work. Even the Arbidol or maybe the other kind of antivirus agent, because so I think that's used in how to say it. I don't know why some doctors choose use the antivirus agent to treat the patients. I don't know why, because no proved the clinical data to show that. So I don't know why. Yeah.
Actually, I remember there were a small-scale trial conducted in Shanghai, and maybe this trial proved to be no effect on the disease.
Okay, that's helpful.
So I think
ahead.
the important thing is that so what if we can activate the immune system in the body, maybe help to help the patient against the virus. I think that's most important than antivirus agent.
So I'm thinking very much about this idea that maybe we can all work together to bring together all the data we have. You, Japan, Korea, everywhere in the world. Singapore has got some, not so many cases. We are going to have, unfortunately, I think, a lot of experience soon. We need to make sure that we're learning from this and also be prepared for any kind of next effort. I will say that this makes me so hopeful that we're all working together, that so many people are listening, and that we're working in ways to try to learn from each other. I'm just humbled by the hard work that you've done and in what you've been through. You know, we're at the very beginning of our journey, and I hope that we can build on your lessons, that we can be more effective because of what you've been able to share with us. And this news of no new cases is really, like I said, something that will give us hope in our country, that you were able to make the difference. If you look to we talked today a lot about acute care, but maybe you can tell that one other thing I'm interested in is in prevention. And there's a lot of concern by healthcare workers here about the danger. We talked yesterday about how you're wearing N95s when you go into the rooms, and in the hospital, you're wearing surgical masks otherwise. But can you tell us a little more about how you prepared, what you wore? In this country, we have a shortage of the protective material, of the uniforms and masks, but it would be very helpful to know what was the most successful strategies you had to protect the frontline healthcare workers, because people here want to be able to learn, and people are also anxious about the infectivity of the virus.
So,
First of all,
can I speak?
okay.
Okay. So, in my opinion, because in Wuhan, at the first initial stage of the the epidemic of the disease, so we are also shortage of the some equipment to protect ourselves. So in that moment, so one effective strategy is that maybe if we wear a protection suit, and we can stay in the suit as long as possible even for 8 hours. And then that means in that case, because we cannot did not wear any protecting suit to go to the work, so we just can prolong the time duration we wear the protecting suit. That's the only way to solve the problem. So it's on the shortage of the suit, the protection.
Hannah, I think the comment is very, very important. I give also advice to the colleagues that either in US and in Europe, I think the protection, especially wearing a mask, even though not in the hospital, I think by the public gathering, is extremely important, and wash your hand. And I was informed that it is not welcome by the citizens that you wear a mask when you take a public train or so on. I think we have during this period, we have really convinced people to accept this. This is very, very important, because you don't know who are infected, who are in this group, they are patients. Secondly, I think in the picture, Juning in his presentation showed what his working suit, and by entering the ICU, and all the members are fully protected, not only by a mask, but also by the glass and the totally suit. I think this is very important. This is why we have 42,000 medical personnel working there more than 1 month. We have zero infection of this medical personnel. I think this is extremely important. And finally, I want to comment is yesterday evening, Helen, Dr. Cao Bing delivered his lecture regarding the version 7 of our consensus or guideline for the diagnosis and treatment of COVID-19. And he said his paper was accepted and will be given out the next morning. I don't know if you have seen this paper published. His conclusion is, by in hospitalized adult patient with severe COVID-19, no benefit was observed with this antivirus drug lopinavir and ritonavir. And this beyond the standard care. I think this study published in New England Medicine this morning, we get this issue. I think just give us the information that we do not have up to now any specific drug which is be sensitive or effective to this specific virus.
That's a very important article, and thank you for sharing that. One other thing on the front lines, were there any medications that you saw people were reacting negatively to, medications that we should avoid as a result, that you saw adverse effects from in the course of caring for these patients?
Okay. Julian?
I mean, the effective drugs for this patient?
No, it says the patient you do not recommend with you use, but getting side effect.
That's right.
My connection is very bad. I'm not getting your
好
question.
问不一会儿黄主任你讲一下，你们发现有哪些药在临床你们用了，不但没有好处，还有坏处。你们不推荐用。
哦，天哪，that's a very tough question. So I would like to say some antibacterials should be very, very strictly used in the patient with COVID-19. You know, this is a virus pneumonia. It's not a lung disease caused by the bacteria. So what I found in some words that the antibacterial was commonly used in this patient. I don't think that's very good for the recovery of this patient. So be careful to use the antibacterials for this patient.
Okay. Well, one more thing for Professor Guo. That so you have produced many useful documents already. Again, remarkable in this period. Are they available in English, and should we make sure that we post links so people can have access?
I can send this to you, Harlan. I can send this to you because I have forwarded to WHF, the World Heart Federation, on the website. I think you can find this. But anyway, I send this to you. I did not. I think I did something not right away. I have to send this to the journal to get published, and we do not send it out, especially how to use the ECMO and what the consensus of the protection our cardiologists and so on. And but I will send this to you. Ask Nancy send to you the files regarding. We have produced 4 consensus, which is previously in Chinese, but we have the English version.
That's terrific. That's really terrific. Thank you so much. You've answered my questions. You all have been amazing and remarkable.
Thank you very much for joining us. I do wish this will be some help for you, especially for the colleagues in the US and also worldwide. Professor Huang, do you still there? Would you give some summary?
Yes. Well, it's a wonderful event. We can share our experience with our American colleagues and also other colleagues from other countries. So this is a very special time, very difficult for all the countries for the COVID-19. But we learned something because we go early. We found some useful experience we can share with our colleagues, other countries. And also very important, I think we continue to organize our system, our some therapeutic systems. And also we are trying to update our some research results and some maybe some new drug in the future. So that's very important. We are keep informed each other. So thank you so much for joining our symposium. Very useful discussion, especially I give our sincere thanks to our doctors. They are heroes in the battle. Thank you so much.
So thank you very much, everyone, and dear colleagues. Thank you for joining us for this telecommunication conference of COVID-19. And I have to appreciate the support of Johnson & Johnson for this program. And this program is organized by the American College of Cardiology and the Chinese Cardiovascular Association. I also thank all the attendees who deliver their presentation, especially the colleagues who are working in the front line, Professor Huang Kai, Professor Zhou Ning, Dr. Huang Zhenying, and Dr. Cao Jiatian. Thank you, Harlan. So goodbye.
Bye-bye. Thank you so much.